today we have with us the consultant of Endovascular, Interventional and NeuroIntervention Radiologist, is Dr. Dilip Kumar, who is going to help us know more about interventional radiology with in specific to neurointervention. So, we already know a background on what intervention radiology is. Can you give us an idea on what neurointervention is?
Neurointervention is actually it's the newest treatment modality. It's the most advanced treatment modality where without doing surgery, you can get treatment of some problems that happens in a brain.
Right.
So neuro is brain. Intervention is you're going to intervene, you're going to do some treatment. So here we are not going to open the skull bone and we are not surgically going to treat the patient. We are just going to put a small injection into the groin of a patient, and through the small blood vessel in the leg, we put a small catheters, tubes, and then we reach the brain itself. We can, through that we will do treatment. Mainly the diseases of the blood vessels like stroke or bleeding in the brain aneurysms, AVM. There are a lot of problems that can happen in the brain. So such neurointervention when we do, the main advantage is that it is not proper surgical thing. So patient recovery is very fast. It's most effective in treating the brain problems, and also recovery is very fast, and there is no scar. That's the most important.
So today most of the patients comes with stroke. So what are the general symptoms they commonly show?
Stroke means some damage is happening to the brain. It's like a heart attack.
Right.
Like whenever the block happens in a heart, so patient come with heart attack. So similarly, some block happens in a brain, so patient also come with brain attack. So stroke, the other name for stroke is brain attack. So it is as severe as the heart attack, because whenever heart attack happens, we reach the hospital immediately, and we know they do angiogram and then they do stenting to open the blood supply to the heart, or else the patient will lose the life. Whenever such damage happens in a brain, one side hands and legs can be completely, they might lose the power to use that part of a limb, or there will be deviation of the mouth to one side. Patient will not be able to speak, and some areas of the brains are so vital that once some problem happens there, patient can lose consciousness completely. They can go to coma. They can have even seizures or fits that we call. So a lot of things can present as stroke. So whenever stroke happens to the brain, we call it actually brain attack, and even that needs immediate attention. So mainly the thing is, here stroke doesn't happen, people don't know when it can happen. So stroke is actually, it needs a public awareness. So the person who is next to a patient who is going to get that problem should identify, should know what are the symptoms of stroke. So it is more of a public problem. It's a community problem that needs to be addressed.
So can you explain to us the different types of stroke?
Stroke can happen because of two things. One is mainly because whenever there is block in a blood supply to the brain, so that part of a brain receives no blood and the oxygen supply is hampered. So then the brain will start getting, the cell starts dying there. So this is called as ischemic stroke, which happens because of a block in a blood vessel. And the other kind of stroke that happens because of bleeding that happens in a brain. Once the bleeding happens, it is called as hemorrhagic stroke. There are a lot of causes for bleeding that happen in our brain. Maybe patients who are having hypertension, aneurysms or AVM, which can rupture, which can burst and cause bleeding in a brain. So these are called hemorrhagic stroke.
So what is the golden period of stroke? What are the treatment that we can offer for a patient who comes under this period of time?
Whenever patient has stroke, if they come within a prescribed time to the nearby hospital, which is a stroke ready center, so such hospitals can receive the patient and they can institute treatment immediately. So from the onset of the stroke up to 6 hours is called a golden period of stroke, where if the patient be able to come to the stroke ready center, we can offer the best treatment for a patient and the chance of recovery is very high. So after 6 hours, the options for treatment for patient is significantly less for a patient with stroke who reach the hospital.
So if a patient comes with a large clot and that patient doesn't receive such care, so what will happen? What are the consequences that can happen?
As I told before, the stroke can happen because of block in a blood vessel and reduce blood supply to the brain. So whenever this block in a blood vessel happens to the major blood vessel, that is a large or big blood supply is being blocked by a clot. We have some treatments like thrombolysis, where we give injection to break the clot and improve the blood supply to the brain. And we have one more treatment which is called as mechanical thrombectomy, where through small groin puncture we take a tube inside the brain and we put a special device in the region of the clot, like it will be like a fish net, and then we capture the clot and we remove the clot outside the brain, and suddenly the blood supply improves. So such treatment can be offered during the golden period of stroke, that is within 6 hours. When we give such treatment during the golden period of stroke, the chance of recovery of a patient is very higher and it will be faster. But as the duration increases, the chance of recovery of a patient is very low.
So now can you explain what is a minor stroke or mini stroke?
Sometimes when the stroke happens, like weakness of one side of a leg and hands, the patient will start recovering immediately. Their symptoms will completely reverse within 24 hours. That is called as, we in medical term we call it TIA, or we can also tell it is a minor stroke or a mini stroke.
So why it happens? Does it have any other symptoms?
So whenever the minor stroke happens, we should not neglect it. The problem is most of the patients, they neglect when they have small problem, and when it recovers they just neglect, they don't go to hospital, and they don't get properly evaluated why it has happened. There are a lot of causes for that. The most common cause for having this minor stroke is a block in a blood vessel in the neck region. So the blood supply from the heart comes to the brain, and through the neck it goes to the brain. So sometimes what happens, patient who are aged, who are hypertensive, diabetic, and with high cholesterol, they might have a block in a neck vessel. So that is called as carotid artery stenosis. That can be a cause for this minor stroke. Or sometimes from the heart also there can be some clot that is going up which can cause this minor stroke. So we need to evaluate why it is happening. So only then we can treat the cause for this minor stroke. If we find some block in the neck vessel which is supplying the brain, so we can simply easily we can treat it by putting a small stent there, which is called as carotid stenting. And even this carotid stenting is actually not non-surgical treatment. It can be done with a small groin puncture.
So like you have mentioned before, some of the patients also comes up with bleeding in the brain. So without doing a major surgery, can intervention radiology can help a person without doing a surgery?
Bleeding in a brain is also a cause of stroke, where patient will have the same symptoms like weakness of one side of a body or speech problem and all those things. Patient can come with coma or severe headache or even seizures. This can happen because of the hypertension, high BP, where the bleeding can happen. Or this can also happen for the treatable causes like brain aneurysm, where there will be ballooning of a blood vessel. So actually blood vessels in a brain should be like a tube, but sometimes there will be ballooning. There will be increase in size of a blood vessel and suddenly it ruptures, it bursts, and there will be significant bleeding in a brain. So this can cause a patient all such problem and they can come to hospital. In such patient also we can do neurointervention, that is without open surgery. If you are dealing with the aneurysmal problem which has been ruptured, we can put some coils inside the aneurysm. We can put a tube inside the brain blood vessel and we can reach the aneurysm and we can put coils into that, which are like spring made up of platinum coils. So once we do that, we can treat this aneurysm.
So you've explained what brain aneurysm is for us. So can you explain what are the treatment options that were available for a patient coming up with brain aneurysm?
When the patient comes with rupture of a brain aneurysm, that is with the bleeding in a brain, we do CT scan and we find out where the aneurysm is and which has been ruptured. There are two treatment options. One is open surgery, where they open the skull bone and go inside, and with the help of a clip, the aneurysm will be clipped at the region of the neck. So once we do that, again that aneurysm is not going to rupture. So this is an open treatment. The other treatment what we do as a neurointerventional radiologist is with a small groin puncture, we take special tubes into the brain and we put a small tube which is called as microcatheter into the brain aneurysm, and into that we fill the aneurysm with coils, small coils which are made up of platinum. So these coils will nicely fill up the aneurysm and thus we'll have a good effective treatment similar to surgical option.
So can you explain what are the advantages by treating a brain aneurysm with coiling?
Coiling is one of the advanced treatment available for brain aneurysm treatment. Mainly since this is a non-surgical treatment with just a small groin puncture. So this is not an open surgery, and the duration of the hospital stay will be less, and the chance of infection will be lower. And one more thing, in elderly patients who cannot withstand the major surgeries, the coiling is a boon. So such treatments are very much helpful for those patients to recover from the underlying condition. Brain is one special organ in a human body, where once the cell starts dying, there won't be regeneration of the cells. So once the damage happens, it is permanent. So neurointervention comes here, it fits in here nicely because in neurointervention we are not interfering with the brain much, but we are treating the related problems of a brain through minimally invasive approach, non-surgical approach. Thank you.